In the last episode, we learned step by step how to perform an intervention of endodontic microsurgery. But I have to tell you that passing from theory to practice can be hard, even if you studied perfectly all of the steps. Did it ever happen to you, Ahmed?
Oh, definitely yes. I think that putting theory into practice is somehow challenging. Let's try to make it simpler. And now, ladies and gentlemen, welcome to episode number 12 of Endocast, hosted by Francesca Cerutti. Hi, Francesca.
Hi, Ahmed, and by Ahmed Shawky, of course. So, there was this second upper premolar that killed me. It had three roots, and it was extremely difficult for me to perform the endodontic microsurgery on it because I felt like I was not managing it correctly. And it turned out well in the end, but I have to tell I was exhausted. And you know why? I had just attended to the course of our guest, and so I called him and I told him what I felt like and what happened. And he found out what my problem was in no time.
But I don't think that you missed some of the clinical steps. I don't think that. It should have been something else, right?
Yes, indeed. And I was so focused on the clinical steps and to follow them correctly that I failed one of the simplest but also most important things.
Ah, I got it. I think you didn't position the patient correctly, so you had a bad vision of your surgical field and everything became so much harder, right?
Exactly, exactly. And our guest, apart from being an excellent clinician, is one of the people that have the best documentation on ergonomics in endodontic microsurgery.
Yes, let's introduce him. Dr. Giuseppe Carrieri, welcome to Endocast.
Thank you very much. Hello, guys. For me, it's great pleasure to hear and to speak in Endocast.
Thank you. We are so pleased that you are here with us. GP,
Yes, very much.
GP, this setup you have in your clinic, I think, is impressive because everything is well studied and perfectly positioned. And I noticed that you always perform endodontic microsurgery with two assistants, and one of them is looking through the microscope. So, why did you choose this option?
Yes, because this microsurgery is very difficult and is important to have two assistants. The first assistant says in the double observator, and is important to see to control the blood and the water during the microsurgery. And the second assistant take me the tools and clear the tools during the surgery. The second assistant follows from the monitor and the first assistant with the double observator.
That's extremely interesting. I guess you have fixed positions when you work with two assistants to make the workflow efficient.
The correct position are important during the perform of endodontic microsurgery because you are to 11 and 12 o'clock and the assistant are to 3 and 9 o'clock.
Thank you, GB. It's very interesting. And we are also extremely interested to know how you position your patient during the surgery?
The patient is in horizontal position, and you move the hand with the sitting. The sitting had a isometric movement and head support, and so is possible to have the perfect position of the patient. It's possible to change the lateral movement to right and left of the sitting for extreme position zone, for example, 7 up or 7 low molar. This is the correct position of left molars and premolars. On the left side, the head must be turned right for right molars and premolars. On right side, the head must be turned left. For incisor, lower and upper, the head must be in a straight position.
That's extremely interesting, especially for me, because the first time to see how you change the position of the head in this way with that isometric headrest. So now, if I'm understanding correctly, that there is also change in the position of the patient according to the phase of the microsurgery you are performing. For example, how do you position the patient to design the flap, for example?
Yes, during the flap and the osteotomy, the patient are left for up and lower molars, left, and premolars. This is the correct position of the show the image, and the up and low right molars and the premolars, and the upper and lower incisor. The patient are in horizontal position. It's possible to analyze singular seats for the molars and the premolars. On left side, the head must be turned right for left molars, and the image show the perfect vision. And for up and the low right molars, the position is right side. The head must be turned left. For incisor, the head must be in a straight position, and we have the image that show the perfect vision for the inferior incisor in the first image, and the up incisor in the second image.
Very interesting, but when it comes to apical resection, things change again. So, why do you move the patient and in which direction?
Yes, after the flap, is important to move the patient during the surgery, upper incisor. The head must be reclined forward during the resection and obturation, because with the microscope you have the perfect image in this position. This video show the correct position of the patient and the vision during the surgery. This is the flap. The flap, the patient is in horizontal position, control the depth of the roots, osteotomy, and you have a perfect vision with the straight angle to remove the granuloma infection with the curette. The assistant control the bleeding and the water, the smoothie of the apex, control with the colorant of blue dimethylene, and with the pellet with epinephrine, the control of the bleeding. Retro preparation with the bar, diamond bar. At the end, the obturation with the bioceramic. The pellet block the gutta perca in the crypta to dry the roots and the obturation with bioceramic. With map system, I use map system and plugger of stile Italiano. At the end, wash with the water, control, and stitching, suture. 6-0. And X-ray is perfect obturation of the canal.
So for the lower incisors, I think it's going to be the opposite. Am I right?
Yes, during the surgery of lower incisor, the head must be reclined backward during apical resection and obturation. Yes, and this video show the example of this position. In this case, we have an incisor to vestibular incisor crown of incisor, and it's very difficult to found the apex. And this position is perfect to endodontic microsurgery perform. Control the depth with the parodontal probe and with the ball bar osteotomy. Control the check with the X-ray, and after the osteotomy, you found the roots, 5 millimeters of deep of cortical bone to remove the inflamed tissue, with the mini curette, and the resection of the roots, control with the blue dimethylene, the perfect cut of the roots. And with this position, you have high visibility during the phases of endodontic microsurgery. The first assistant control the water during the shaping of the roots, dry the roots, and the obturation with the map system. Mini plugger of stile Italiano to remove the excess of bioceramic and wash. And with this technique is important because you don't have washout and stitches after the surgery. Final X-ray.
Very, very nice cases, GP. Thank you. And this is where I failed in my case. So please tell us how to position a patient for upper premolars and molars.
During the surgery of the up molars, the head must be lifted forward and turned right, because so you have the visibility of the apex and the control during the resection and during the obturation. This video shows the perfect vision that you have during the surgery of the premolar. In this case, I used the bar, and with the bar you have a great visibility with the straight handle of shaping of the roots and obturation with bioceramic. Wash the excess, no washout, and the suture. Right, right molars and the premolar, the patient had, must be lifted forward and then turned left for apical resection and obturation. And next video show the perform of endodontic surgery, osteotomy. You have a great visibility with this position to remove the inflamed tissue, smoothing the roots, and prepare the canal with bar. This is a okay, okay, K-hole, sorry, K-hole, to have a space to use the 6 bar, 6 millimeters, control of the blow, and obturation with bioceramic. Wash the excess and remove the. In this case, I used the contrast because I was near the sinus.
So thank you for this videos, and I have to say that again because I said that to you before. It's a very nice documentation, really clear. So thank you for this videos. But I am curious to see how you manage lower molar and premolars.
Yes, the molar and the premolars lower are very difficult, and is very difficult to have the perfect vision during the surgery. And this position of the patient, the head must be reclined backward and then turned left. You have a great image of the roots during the surgery. This case show the perfect vision of the mesovestibular roots during the molar surgery. The flap, the patient are in horizontal, and now change the position to the resection. You have a perfect image. Is not necessary in this position the use of the mirror, micro mirror. The istmo with the bar and shaping of the roots, dry the roots, and obturation with bioceramic with map system. To remove the excess with mini curette, and this is the final X-ray after the surgery. Lower left molar and the premolar. The head must be reclined backward and then turn it right. This is a very difficult case. It's 7 molars inferior with the thickness bone and the osteotomy, and now to remove and control the anatomy with the diamond bar. You have a perfect visibility during this surgery in this position. Is important in molar, in posterior molar, 7 molar, and obturation of the mesial and the distal roofs. Clear to remove excess and suture.
I think that this is one of the lectures that one should rewatch while planning an intervention in order to be sure that everything is in the right place.
I completely agree with that. It's very important, and this will make the work flow more easy because you can control the
Yeah,
procedure when you see
thank you,
well.
GP.
Thank you for having me. It was a pleasure.
So, guys, I hope you find it useful and beautiful because it is very beautiful to see those cases. So, thank you for watching and stay tuned for the next episode of Endocast. Ciao.
Bye.
Bye.